Well, for some people, none. Crickets, silence. Your body will put up with a lot of this for a long time. And that gives you more room to like pretend that we're getting away with it. It's really interesting because there's a British reality TV show about murders. And there's an
Mm.
episode from 2011 about a wife who tried to poison her husband and almost succeeded. He came this close to dying. He spent months in the hospital in a coma. And when he did finally come out of the coma, he was deaf and blind and liver damage and had many other problems. And the whole time, what was wrong with him was oxalate poisoning, and the clinical people could not recognize it. So even when you're dying of
Mm.
oxalate poisoning, the clinical people don't see it, and we don't see it. So it can be silent for because the symptoms aren't there, or it can be silent because we don't have a clue on how to listen to the body and read the signs. But if you have signs of oxalate issues, where you could just take a high oxalate meal, juice a little, half a star fruit or some green, make a green smoothie, and then check in with yourself 90 minutes later and say, how's my attention? How's my energy? How's my digestive tract? How's my brain working? How are my aches and pains going? And you might be able to notice things are not great. You may start getting hiccups or belching. You might get masseter pain or any kind of joint inflammation. You could start being grumpy, irritable, impatient, panicky, worried. In the old literature from the 1840s, 50s, and 60s, there's descriptions of the symptoms include things like anticipation of impending doom. It's one of the symptoms because there's a lot of neurotoxicity with oxalates because it is a chelator of calcium and other electrolytes. You mess up the electrolytes, especially calcium, for a
Mm.
nerve cell, and
Mm.
boy, things start going wrong. And there's a fair degree of distress. It turns on nerve cells in this on position that can cause spasms, and that's where you get the belching and the bloating and the hiccups and maybe diarrhea or constipation or muscle knots or fibromyalgia, you name it, reflux. There's all kinds of weird things that can go on when you're just poisoning the nerves, but there's also turning on the immune system in where you've got deposits now forming in tissues. You can get aches and pains and gout-like symptoms. But in the short run, within an hour of that green smoothie, you've damaged the immune cells, and they're now putting out pro-inflammatory cytokines, and they're not able to handle infection. So if you have chronic sinus infections, chronic yeast infections, things that keep coming back, and you have to keep getting antibiotics, like I did as a little child who was eating rhubarb, uh, ending up on, penicillin, strep throat, ear infections, and then I had my tonsils out. Those were probably signs that the diet was already too high in oxalate for me as a little kid.
Mm. And it's very much about accumulation as well, though, isn't it? So obviously, as you get older, you might accumulate more deposits in the body.
And eventually the system breaks from
Mm.
having to deal with those deposits. It's constantly having to hold on to it. And one of the reasons it's doing this is because the day to day onslaught coming in is so exceeding your safe level in your bloodstream and in your kidneys and in your urinary tract, which is where it leaves the body principally, is in order to protect the blood, hence the heart and the
Mm.
critical organs, and protect the kidneys, which are really important regulatory organs. It's not just cleaning your blood, they do so much for you. And the body's smart enough to protect the kidneys from damage by holding on to the crystals. And of course, the crystals that form, because it's the acid you're absorbing. You're eating crystals and acid. The crystals are there to irritate and wear down your teeth and irritate the gut. And the acid can get into the bloodstream and start damaging the cells of the vascular tissue and damaging the cells in the blood, like the immune cells and the red blood cells, goes straight to the liver, uses up a lot of glutathione there, then goes straight to the heart, can start collecting in tissues wherever there's inflammation, infection, injury, tissue recovery, because when a cell is replicating, it has a certain style that makes it stickier to oxalate. And when cell bits are fragments are around because a cell was injured today or is dying, that creates this environment where precipitation happens. What precipitation means is that the acid and then the little calcium oxalate individual molecules start coming together and forming crystals, and you start getting nanocrystal formation. Nanocrystals of any kind, of particularly calcium oxalate, are the most toxic form that you can have of oxalate in your body, and that's invisible, and science has no way to really see them or measure them. But you're basically forming nanocrystals after you consume these foods, and you can get acute problems that may or may not have symptoms. And in the background, you're building up this debt where you're accumulating oxalates in tissues that are really, you don't want them in. Your eyeballs, number one, your thyroid, number two, your kidneys, your bone marrow, that's where all your blood cells are born, and your bones, etc., and your tendons, and it keeps going.
Yeah, and the other thing as well that again it was clear in your book is that the blood needs an optimal level of calcium at any one point, and if it gets too low, then it's going to start leaching it from the bones, and then obviously that can lead to things like osteoporosis as well.
Yes, and it creates a certain inflammation that adds to the acidity. Oxalic acid is adding an acidity component, and then it's adding an inflammatory component, and both are causing acidity. So you use the bones not just to replace the missing calcium, but you use the bones to replace the alkalinity that you need. You need it closer to a neutral pH, and if it keeps going acid, the bones have to be the chalk that you use to manage that pH. The pH is not a compromise. We will use your bones to the nth degree to save the pH so that you can function. But when your blood is low in calcium, the pacemaker in the heart gets confused, and it can't quite keep the rhythm right, and you start getting arrhythmias. And we even see this with the oxalate coming back into the bloodstream from the tissues, no longer from the diet. When you change your diet, now you have this old stuff from your diet from the past in your cells, in tendons and joints spaces and so on. And the body does want them gone, and you're finally giving this opportunity so you can raise your oxalic acid levels in your blood, cause crashes of calcium levels, and cause arrhythmias, heart palpitations, huge raise, spikes in your blood pressure, and so on. Strange numbers in your tests happen. There's just a lot of mayhem can start happening when there's too much oxalate in the body, because it is the simple act of being able to steal calcium makes it profoundly toxic. And it does more than that. And of course, the downstream effects of that are profoundly toxic. The way it's damaging membranes, but the way it's turning on inflammation in response to that damage, the way it's interfering with enzyme function. The number of mechanisms are huge, but if all we had was calcium interference, that's enough to be toxic.